A behavior technician notices that a client engages in a challenging behavior only when their sibling is present. This suggests the behavior is maintained by A. Automatic reinforcement. B. Attention. C. Discriminative stimulus control. D. Tangible access. Answer: C. The presence of the sibling acts as a discriminative stimulus, SD, that signals reinforcement availability. During discrete trial training, which of the following would most effectively test for stimulus generalization? A. Repeating the same prompt multiple times. B. Using a different but similar item to teach the same skill. C. Changing reinforcement schedule to variable ratio. D. Requiring the client to imitate only exact responses. Answer: B. Generalization is tested when the learner responds correctly to novel but similar stimuli. If extinction is applied inconsistently, the most likely outcome is A. Rapid elimination of the behavior. B. Strengthening of the undesired behavior. C. Immediate generalization of skills. D. Replacement with adaptive behavior. Answer: B. Intermittent extinction can strengthen the persistence of the unwanted behavior due to reinforcement unpredictability. When implementing a behavior intervention plan, an RBT should prioritize A. Efficiency over accuracy. B. Data collection integrity. C. Reinforcement magnitude. D. Naturalistic teaching only. Answer: B. Reliable and valid data collection is critical to evaluate the plan's effectiveness. In functional communication training, the alternative response must be A. More effortful than the problem behavior. B. Equal in effort to the problem behavior. C. Less effortful and equally effective. D. Reinforced only intermittently at first. Answer: C. Replacement behaviors must be easier and equally effective to compete with problem behavior. Which situation best illustrates stimulus fading? A. Reducing the loudness of a prompt until it's gone. B. Removing reinforcement gradually. C. Presenting the SD only occasionally. D. Using a different reinforcer each trial. Answer: A. Stimulus fading involves gradually removing or altering prompts while maintaining correct responding. If a client demonstrates spontaneous mands without prompts, this reflects A. Tact extension. B. Functional independence. C. Intraverbal chaining. D. Natural environment training. Answer: B. Functional independence occurs when a skill is performed without prompts or contrived reinforcement. An RBT is told to prioritize differential reinforcement of incompatible behavior, DRI. Which choice best represents DRI? A. Reinforcing hand-raising instead of shouting out. B. Reinforcing on-task behavior only when quiet. C. Reinforcing requests for toys only when not whining. D. Reinforcing compliance after multiple prompts. Answer: A. Hand-raising is physically incompatible with shouting, making it a true DRI example. A variable ratio schedule of reinforcement produces A. Low, steady response rates. B. High, steady response rates. C. Scalloped response patterns. D. Extinction bursts. Answer: B. VR schedules produce high, steady response rates due to unpredictability of reinforcement. The ethical principle of do no harm primarily requires an RBT to A. Implement procedures only with parental consent. B. Prioritize client welfare above personal gain. C. Ensure reinforcement magnitude is consistent. D. Report data only when favorable. Answer B. Client safety and dignity must come before convenience or self-interest. If a skill taught in the clinic is not observed at home, the RBT should suspect A. Maintenance failure. B. Generalization deficit. C. Reinforcement mismanagement. D. Poor extinction control. Answer B. Generalization deficits occur when skills don't transfer across environments. Which of the following demonstrates response latency? A. Counting number of words spoken. B. Measuring time between instruction and client's action. C. Recording how long a tantrum lasts. D. Calculating rate of behaviors per minute. Answer B. Latency measures the time from stimulus presentation to initiation of response. Why is Inter-Observer Agreement, IOA, important in ABA practice? A. It prevents reinforcement misapplication. B. It ensures treatment is individualized. C. It validates data reliability. D. It guarantees rapid skill acquisition. Answer C. IOA checks data consistency across observers, strengthening validity. When a behavior plan specifies pairing, the RBT should A. Associate themselves with reinforcement. B. Pair client responses with data sheets. C. Present SDs without reinforcement. D. Pair extinction with punishment. Answer A. Pairing means becoming a conditioned reinforcer by associating with positive experiences. A task analysis is most useful for A. Teaching change skills systematically. B. Identifying reinforcer preference. C. Reducing task demands. D. Measuring frequency of single behaviors. Answer A. Task analysis breaks complex skills into teachable steps. If a token economy loses effectiveness, the most likely reason is A. Tokens are delivered too frequently. B. Tokens are not paired with meaningful backup reinforcers. C. Too few staff are delivering tokens. D. Tokens are used in multiple settings. Answer B. Without valuable backup reinforcers, tokens lose motivational value. Which is an example of shaping? A. Reinforcing successive approximations toward a target behavior. B. Teaching a change skill one step at a time. C. Presenting multiple stimuli in a random order. D. Using errorless learning procedures. Answer A. Shaping gradually reinforces closer approximations to the desired response. An RBT must discontinue a session immediately if A. The client requests a break repeatedly. B. The environment poses imminent danger. C. The client refuses reinforcement. D. The parent questions data accuracy. Answer B. Safety concerns override all other session goals. When should data be recorded? A. Only after the session is complete. B. During or immediately after the behavior occurs. C. At the end of the week for accuracy. D. When the supervisor requests it. Answer B. Real-time or immediate recording ensures accuracy and reduces recall errors. A discriminative stimulus signals A. The availability of reinforcement. B. The absence of reinforcement. C. An automatic reinforcement condition. D. A punishment contingency. Answer A. An SD signals that reinforcement is available for a specific response. In negative reinforcement, the behavior is strengthened by A. Adding a positive stimulus. B. Removing an aversive stimulus. C. Withholding reinforcement. D. Applying punishment contingencies. Answer B. Negative reinforcement strengthens behavior by escape or avoidance of something unpleasant. Why is continuous reinforcement not ideal for long-term maintenance? A. It creates rapid extinction once removed. B. It produces slow acquisition of behavior. C. It prevents generalization across environments. D. It interferes with shaping procedures. Answer A. Behaviors on continuous reinforcement extinguish quickly when reinforcement stops. If an RBT observes an unfamiliar behavior not in the plan, they should A. Ignore it completely. B. Immediately apply extinction. C. Document and report it to the supervisor. D. Create a quick intervention. Answer C. New or unexpected behaviors must be documented and communicated before action. When reinforcement is delivered after varying periods of time, this is A. Fixed ratio. B. Variable interval. C. Variable ratio. D. Fixed interval. Answer B. Variable interval schedules reinforce the first response after unpredictable time intervals. Errorless learning prevents A. Skill acquisition. B. Reinforcement dependency. C. Incorrect responses from being practiced. D. Stimulus generalization. Answer C. Prompting prevents errors, reducing the chance of reinforcing incorrect behavior. A client imitates a behavior after watching their peer perform it. This is A. Intraverbal response. B. Social referencing. C. Modeling. D. Stimulus fading. Answer C. Modeling involves learning new behaviors through observation and imitation. Partial interval recording is most likely to A. Overestimate behavior duration. B. Underestimate behavior frequency. C. Provide exact count of behavior. D. Eliminate observer bias. Answer A. Partial interval often records behavior if it occurs at all, inflating estimates. Which of the following is most important for treatment fidelity? A. Consistency in staff implementation. B. Frequent reinforcer changes. C. Parent involvement only. D. Data collection without supervision. Answer A. Fidelity requires interventions being carried out exactly as planned across staff. If reinforcement is delivered for progressively longer durations of behavior, this is A. Duration shaping. B. Response chaining. C. Variable interval. D. Successive extinction. Answer A. Reinforcing longer durations strengthens persistence in the target behavior. A client engages in tantrums only when denied access to electronics. What is the likely function? A. Escape. B. Attention. C. Automatic. D. Tangible. Answer D. The behavior is motivated by access to tangible items, in this case, electronics.